As of this morning, the South Dakota Health Department reported 747 new positive coronavirus cases. However, the department says that its website reporting is experiencing some delays.
48 of those new cases are in Cottington County. KELOLAND's Lauren Solik spoke with a Watertown man about his experience with the virus and the frustration that followed.
Mike Waldner says he tested positive for COVID-19 on September 21st.
I was in bed for 5 days, couldn't hardly move. And it come on just like that, and it went away just like that.
He was told after taking the test that the Department of Health would be contacting him for tracing, but that never happened.
Everybody that I have talked to that has had COVID, not one of them have received a phone call from the Department of Health.
Waldner called the Department of Health himself to find out if he could go back to work. He wasn't expecting the answer he got.
When I called them, they had no record of my testing at all.
Waldner says he doesn't blame the people at the Department of Health.
They need to get more help in the Department of Health. They need to do better tracing. Cottington County right now is exploding with COVID.
During today's health briefing, KELOLAND News asked the Department of Health about the possibility of tests being lost.
We are not aware of any tests being quote-unquote lost. I would say that when it comes to individuals being notified, that is where it is possible that individuals are being notified, at the same day or shortly after they, would be typically released from their isolation period.
Waldner says he is now returning to work after 10 days of being gone.
Social distance as much as you can. I know it's hard to do, but people need to get back to work and stuff. But we do need a better tracing is what we need.
Lauren Solik, KELOLAND News.
Waldner says he did call his physician to make sure they sent his test to the Department of Health. He was told that they did.